He was the cutest little boy ever. I've always adored him. So strong, so sturdy, confidently changing through life. At 10, he joined a Little League baseball team and made the All-Star team his first year. It was not until some quite later that I realized something was very wrong. Probably his first symptoms was at age 11. After being promoted up to the next division in local league, he mostly sat on the bench. His coordination was not as good, and he seemed to have lost his hustle. Of course, it was probably just that he was being expected to do too much, and it was easy to overlook. Then he began to grow.
We moved a lot when I was younger. It was hard to make friends when you're rarely in one place for too long, so it became more introverted. When I turned 15, things started to feel off. I was 6 foot tall, wearing a size 13 shoe, but I only weighed 150 pounds. My right knee began to swell, and I developed mysterious, ulcerated sores on my lower left leg that refused to heal. I began to complain often of feeling sick. I came home from school frequently. Nothing was ever seriously wrong. I just didn't feel good. We decided to see a doctor.
When Eric came into my office for the first time, I instantly knew this was a very unusual case. The largeness of his hands and feet led me to check blood levels of some hormones. His thyroid was down, his cortisone levels low, his testosterone levels low, and his growth hormone levels high. Tabs of his right knee were moved up to 500 cc of fluid, but no evidence of anything specifically wrong inside his knee, just that it was being damaged. He looked gone and healthy.
Then, Eric fell and broke his left hip. These symptoms all indicated that a benign pituitary tumor had put pressure on the pituitary and disrupted its functions. It was an unusual condition, and this was the first case Dr. Kidd had ever seen. Eric was referred to a hospital in Madison, Wisconsin, where they used iridation to kill the pituitary and any tumor associated with it. They also had to do cartilage operation on his knee and put metal pins in both hips to hold the ball and socket joining together.
The state-of-the-art treatment at the time that I had this tumor, which was in the early 70s, was actually surgery. Going through the top of the head, through the brain, the pituitary hangs down underneath the brain between your ears, right in the middle. With the surgery, about 50% of the time resulted in the patient dying, and almost always the patient went blind.
Eric opted for a different route, a then new and largely untested method, radiation. It was the right call. The radiation killed the tumor, but as a result of the treatment, the entire pituitary gland was destroyed. That's when the doctors started Eric on heavy hormone treatments.
The good news was that everything seemed to be working. I was 6'4" and weighed over 220 pounds. X-rays of my skull showed that the bone saddle the pituitary rested on was healing over, which indicated that the tumor was no longer putting pressure on the bone and therefore had probably been destroyed.
The pituitary gland is a tiny organ the size of a pea found at the base of the brain. As the master gland of the body, it produces many hormones that travel throughout the body, directing certain processes or stimulating other glands to produce other hormones.
One day, Eric came into my office for his normal checkup, and he dropped some news on me. He was getting married. It had never occurred to me to discuss it before, but normally patients with these syndromes were sterile, and Eric had little body hair and had told me he never shaved. I didn't know what to tell him.
Due to his absent pituitary gland, his FSH, which makes sperm, and LH, which develops sperm levels, weren't making him sterile. The lack of facial hair tells doctors that Eric is not producing luteinizing hormones.
I was upset when Dr. Kidd told me I was most likely sterile. All I'd ever wanted was to have a family. Doc recommended injections of human chronic gonadotropin in an attempt to produce sperm. But after 2 years, nothing was better. I was growing a beard. I had to get wires in my mouth. The dentist thought I might have had temporomandibular joint dysfunction. Due to an aching jaw, the wires caused me frequent headaches, though. At this time, I weighed about 310 and was 6'6".
Eric's upper jaw and lower jaw were growing at different rates. The dental surgeon broke the lower jaw to try and preserve his tegmental nerve. As he grew older, his medical problems only grew more frequent. HCG, which Eric had been taking in an attempt to produce sperm, acts like FSH and LH and triggers a variety of secondary sexual characteristics, including facial hair. Having too much growth hormone in childhood produces giantism, but too much growth hormone later in adolescence produces acromegaly. Acromegaly is marked by differential growth. Bones that have already fused do not grow, but other parts of the body can grow. Typically, it is most pronounced in areas such as the hands, the feet, and the jaw. Thus, Eric's lower jaw grew, but his upper jaw did not, causing a misalignment.
Eric's hormones are seriously whacked, and trying to keep all of them in balance plus dealing with his high blood pressure is a bit like juggling china plates while riding a unicycle. As if that wasn't enough, he kept coming up with odd things.
One morning, his right eye stopped working, which led to the diagnosis of an aneurysm in the artery immediately beneath the pituitary. The aneurysm was due to radiation damage in the blood vessel walls in the area of the tumor. They had gone in and surgically wrapped it to hold it together, but his recovery had taken months. 14 months later, his right eye began to work again, although he lost most of his peripheral vision. A stroke he had 2 years later may have been due to radiation or due to high blood pressure, but meant frustratingly long months of physical rehab. And of course, just to make things interesting, he had to have the stroke while he was in a jungle somewhere in Costa Rica.
He came home from China testing positive for tuberculosis, from the Marshall Islands with beaver fever, and from Costa Rica with parasitic body flies burrowing under his skin.
Eric wasn't sleeping enough. Eventually, we have figured out that his sleep was getting seriously disrupted by frequent nighttime trips to the bathroom. We know Eric always has medical problems and that they are all tied back to his pituitary gland. It's just hard on our 2 daughters to always see their dad in so much pain. If we had known what his medical future had in store, I'm not sure what we would have ever adopted.
It's quite normal for a 45-year-old male to make one nighttime visit and dump 350 cc of urine, but ask him to record the frequency of his visits and the quantity of urine produced. When I got the chart back, I realized I had finally had a problem I could solve. The diabetes insipidus was so obvious when you looked at his data, and all I had to do was write one prescription.
Eric's kidneys were so active at night because his antidiuretic levels found in the posterior pituitary were damaged, causing him to release water all the time instead of having the kidneys keep some.
Eric doesn't seem to be getting better, even with all the testing and medication he receives. There's always something new wrong with him. His pituitary is going to continue to be a problem for him for the rest of his life. Some problems may go away, but only time will tell.
Most people I tell my medical history to are amazed that I'm still alive. They didn't think you could live without the vital pituitary gland. My hypothalamus controls the regulation of the pituitary gland hormones. Right now I'm 52 years old. Things are going right. Things are going okay now for me medically, although I've just been diagnosed with type 2 diabetes. I have 2 loving adopted daughters and a caring wife, and I teach plant ecology and introduction to biology.